every society can be divided into the three groups, taking into account their health condition. Healthy people, healthy group, ill but curable people, and incurable people. So these three groups, if these three groups are existed, national or country health care system must have three directions, three programs. For healthy people, it is preventive program or preventive direction. For ill but curable people, it needs to have the curative programs. But for the third group, it's necessary to have the palliative care programs. Such kind of understanding and sharing this understanding with other people helped us very much to obtain support from our government, from our NGOs, some decision makers, and so on and so on.
During these 10 years, I can tell you that palliative care becomes one of the real parts of classical medicine, and our state structures, government, policymakers, decision makers, they are really helping us to moving forward.
We are having a big emphasis on pain relief and giving adequate access to pain relief to every patient in the country.
Right now, patients have to go to the police stations to get their pain management drugs.
Yes, this is a very unpleasant development when the patients need to go there in order to have prescription. Of course, this is something that helps actually more their stigmatization than the real pain relief. And a number of our partners are trying to advocate against this. In addition to the issue that we have already mentioned, of course, there are others. First of all, we need to increase the budget allocation for palliative care.
We have more other difficult problems which we need to decide. For example, now we can prescribe morphine for 7 days. We need to increase this term up to 30 days, for example.
Education is one of the first urgent reason for us to create the good palliative care service. Education is very important.
In other places, you might have time set aside from your employer to get special training. Here, I don't think that that's possible. And so people are trying to work in training around their jobs and their patients. For instance, our oncologists who are in the community, they kind of work on their own, and so they only can come in the afternoons. So we've had to try to see how we can fit them in. At the same time, they are doing a lot here, and I have a lot of hope for Georgia. They are willing to change their laws and their policies, and they're willing to do the education. And I'm actually very encouraged. There's other places where that's not true.